Gypsy here from Bipolar Peer Chat. Today's topic's going to be medications. Something that I've read a lot on some of the groups and some of the people that I work with has made mention that they feel like a guinea pig due to all the medication changes and trying this medication and trying that medication. I myself feel this way sometimes. I've been working with my psychiatrist for 2 years now, and we're just now kind of getting to that right bipolar cocktail mixture, or med mixture, however you want to say it. It's frustrating, guys. I know it's frustrating, but please, please, please stick with it. Hang in there, because once you do get that right medication, it is so well worth it. My psychiatrist and I, just the other day, went through the entire list of medications that we have tried me on over the past 2 years, and it was over 20 medications, and honestly, half of these medications I don't even remember taking. Either it zombied me out to the point that I just don't remember them, or I was on them for such a short period of time, I just don't remember them. So, stick with it. Hang in there. It's rough, it's tough, but it's so worth it in the end to get that happiness that we're all seeking, that even ground, that calming effect that these medications help with. Also, medications is not the only thing you need to work on. You have to work on yourself. You have to work on changing your mindset for a lot of stuff. You know, you can't let depression set in. You have to pull yourself out of it and get going. I know it's hard. I know it's tough, but please work on it. Work with a counselor if that's what it takes. I also know that some people have been successful in going off their meds. I can say I do not recommend this. Do not do this without consulting a professional, your psychiatrist, your doctor, because this can be dangerous. Some of these medications that we're on needs to be tapered off versus stopped. So please consult your doctor. Some people has been able to go off due to lifestyle changes, change of their mindset, change in their exercise programs, change in their diets, going vegan, whatever worked for them. That's super great. I'm excited for them. More power to them. I reiterate, do not try anything like that without talking to your doctor first. One thing that bipolar people and other people that suffer mental illnesses are guilty of is waking up one day and go, hey, I feel great, so I'm not going to take my medication today. And guess what? The reason we feel great is because our medications are working. So don't stop them. They're doing their job. Now I'm going to move on to adjusting to new meds. Talk to your family, talk to your friends, talk to even your coworkers and your boss. Let them know that you are starting a new medication. Let your coworkers and your boss know this, because this medication could cause drowsiness or dizziness, and it could affect the workplace. So be safe and talk to people. Talk to your friends, talk to your family, talk to the person that you spend the most time with, because sometimes they can pick up on the slightest little detail in a change in you that you don't notice yourself. So it can be very important that, you know, they may pick up on something that you're overlooking because the medication is making you drowsy or just into a zombie-like state. Certain things that you might feel when you get a new medication is drowsiness, sleepiness, fatigue, headache, dizziness, upset stomach, hyperactiveness. If you suffer any of these, some of these are common side effects. They may go away. Again, I'm not a professional, so if you have any kind of concerns when it comes to your medication, please contact your pharmacist or your doctor or your psychiatrist. Definitely pay attention to some of the more dangerous warning signs. Rash-like symptoms, hives, shortness of breath, difficulty breathing, fever, flu-like symptoms. These are things that you really need to watch out for and contact a emergency personnel or a medical professional immediately if you're feeling some of this stuff, because it can be dangerous. Read the pamphlets that come with your medication. I can't stress this enough. these are our medications. We need to be aware of what's going on with our bodies. And we can't be aware if we rip that pamphlet off and throw it away. So read the pamphlets that come with your medications. Because sometimes we may forget to tell our doctor that we're on this medication that a different doctor prescribed to us. So they don't have it in their list. So they're not going to know that what they just gave you is going to counteract. Also, make sure you tell your doctor what you're allergic to, even if it's a food item, because some of these medications could have a food item in it. Coconut oil extract, for example, I'm highly allergic to coconut. So, that's something that needs to be in my chart. Make sure to tell your doctor about something like that. Another important thing is to keep your meds in a safe place. Keep your meds away from pets. Keep your meds away from your kids. Keep your meds away from family members, especially those that may suffer addictions, because they may not know that what they might snag out of your medical bag is going to be dangerous if they take 3 or 4 of them. So make sure you put them up in a safe place away from people. They're not in view of everybody and anybody, even a neighbor that may come over. I mean, you just never know. So be better safe than sorry when it comes to this kind of stuff. Also, especially during starting a new medication, be careful of driving. I can't stress this one enough. Because it's a new medication, you don't know if this medication is going to make you dizzy to the point of passing out, or make your vision blurry, or just extreme fatigue and you're not paying enough attention. So be careful driving. Another thing that I want to cover, since I have said so many times in this video to contact your doctor, contact your psychiatrist, contact your pharmacist, is do not feel like a bother or a nuisance contacting these people. I don't care if you get free Medicaid. I don't care if you pay $1,000 for your insurance every month, or anywhere in there between. Essentially, these doctors and psychiatrists work for you. So don't let them make you feel like a bother or uncomfortable. And if they do, you might want to start looking at other options as far as your doctor or psychiatrist. Immediately, if you feel symptoms like your mania is acting up, your depression is going crazy, your mood swings, rapid cycling, your anxiety is through the roof, please contact them. They will not know what's going on with you if you don't tell them. They're not going to know that you might need a med adjustment or need to be put on different meds or a new med if you don't let them know how you're feeling. So it's important to you, it's important for you to let them know how you're feeling every time your mood changes. And with that, we're going to kind of move on to the boring stuff. A lot of people will not need this part of the video. What I'm going to do here is kind of just explain how to take your medications properly, because some people don't know the proper way to take their medications. So this is just kind of a quick rundown of how to properly take your medications according to your labels. If you have any questions or concerns, don't hesitate to call the pharmacist or your nurse practitioner or your doctor or your psychiatrist, because sometimes these medications can be confusing. If you have a medication that says take once a day, it's important to find out whether or not this is a medication that you should take in the morning, or if it's a medication you should take at night, if it's something that you need to take with or without food. So ask those questions. This medication says to take 1 tablet by mouth twice a day. And what that means is you're going to divide up your 24-hour day into 2. So every 12 hours. So you're going to take this medication at like 10 in the morning and then again at like 10 p.m. So that's pretty, self-explanatory. This one says the exact same thing, except it says take 1 tablet by mouth twice a day with food or milk. What that means is you need to make sure that you're eating or drinking a glass of milk when you take this medication. Do not put this medication on an empty stomach. So you would have it at like 9 in the morning with your breakfast, and then drink a glass of milk or a snack 9 at night, when you take this medication again. This medication says take 1 capsule 3 times a day. And you would divide up, your 24-hour day, which would be every 8 hours. And logically, that may not be possible because that means you would wake up in the middle of the night to take this pill. So the way I personally take this pill, not that this will work for you, but what works for me, is I take this pill at 9 in the morning, and then again at 3, and then again about 11 o'clock right before I go to bed to make sure I'm spacing this pill out enough and it's not overly medicating me. I'm going to go over an as-needed medication. This pill says take 1 tablet by mouth 3 times a day as needed. As needed means you don't have to take this pill every single day. You take this pill as you need it, only when you need it. Say, example, if this pill was for anxiety, you wouldn't take this pill every single day, not unless your anxiety is acting up. So if your anxiety starts flaring up really bad, you're having anxiety or panic attacks, you take one of these pills. But you do not take it 3 at once. You do not take more than 3 in a day. If your anxiety acts up more than the 3 times in a day, you definitely need to talk to your physician about this. Again, will not take this pill every day unless your anxiety is acting up. So you may go 3 or 4 days without having to take this medication. You take it only as needed. That is the stressor here, only as needed. This one's a little bit more tricky. This is what's called a build-up pill. You're going to start off on 1 dose and gradually go up to a higher dosage. And a lot of people with mental illnesses have pills like this, especially when they're new and you're first starting it. And this is a new pill for me. It says take 1 pill at bedtime for 2 weeks. Then take 2 tablets at bedtime for 2 weeks. And then contact your doctor. Set up an appointment. And you do exactly what this says. Come bedtime, I take 1 pill. I actually have it marked on the bottle that, a certain date I would start my 2 pills. So for 2 weeks, I take 1 of these. And after those 2 weeks, I take 2 of these. So make sure you understand when it comes to pills like this, because they can be a little bit confusing. Another confusing type of pill is if you're taking the same pill but in 2 different doses. I happen to have 2 of these pills. It's the same medication, but I take 2 separate doses of it. One is a 75 milligram and one is a 37.5 milligram, which means I'm taking a total of 112.5 milligrams of this a day. I take them together. The reason behind this is because 2 75 milligram pills would have been too much for my system to handle. So I take virtually a pill and a half a pill. And versus me splitting pills, they gave me 2 separate prescriptions for this. Well, that about sums this video up. If you have any questions or concerns, please talk to your pharmacist. Please talk to your doctor, your nurse practitioner, your psychiatrist. So until next time, peace, big love. Join us on Facebook. Our group again is Bipolar Peer Chat. Like us here, share, and see you next time.